Hi, my name's Sam and this is a Serotonin Session. So before I get into my session today, I just need to do a little quick disclaimer. I'm going to be talking about lower back pain today from the perspective of a physiotherapist. I am a trained and qualified physiotherapist. I'm a band 5 at a hospital. However, the views I'm going to be talking about today are by no means associated with that hospital I'm working in, and they are no means associated with where I trained in my degree. These are based on my personal experiences. I have done a placement in the musculoskeletal outpatient setting, which is where you'd come across this sort of thing. However, I am not a specialist in that area and I'm not currently working in that setting. So if you are experiencing back pain, please do not take this video as replication for going and seeking medical attention. Please go to your doctor or self-refer to your physiotherapist and they will be able to give specific specialist advice to you. This is kind of meant to be a bit of a general advice and hopefully people will be able to take away something useful. So, as I mentioned, the video today is going to be about lower back pain. Just to give you a little overview of what the video is going to be. There's going to be a little bit at the beginning, kind of a general summary of what your lower back is, a few bits of advice around lower back pain itself, bit of anatomy, but nothing too heavy. Then we'll go into, I think what's quite important, some myth busting around back pain and a lot of things within physiotherapy people tend to come in with views about and concerns about. Hopefully try and put a few of those to bed. And then at the end, I'm going to go through some exercises that are general back exercises that can be used to either relieving or hopefully a little bit of strengthening that maybe people can take away and try to implement, and it should help with that back pain. So, non-specific lower back pain is the kind of overview term for what we're looking at today. This is lower back pain that doesn't have a specific cause. So say for example, a fracture in the spine, an infection in the spine, or even something like a tumour, that would be the reason for the pain. This is something where you've got back pain, but you're not sure of the specific reason. It could have gradually come on, it could have come on because say you've pulled it doing something, and it's just got that achy, muscular lower back pain. We often hear people say things like, oh, when I first get going in the morning, it's quite stiff. Going from sitting to standing, or if I've been sitting for a long period of time, it feels quite stiff. That's the sort of thing we're expected to see. So it tends to be, like I said, this lower region. Now, this is where we have the lumbar spine. As you can see, these are these nice big joints here. So they're quite a lot larger than if you look at something like the cervical spine. So these ones up the top here are quite thin in comparison. That one's very thin, this one's very large. And that's because with the spine, they're absorbing a lot more of the body weight. With the gravity, they're holding up a lot more of the body weight when you're moving, when you're walking around, things like that, which is why they're quite a lot chunkier. Looking at the anatomy a bit more specifically, you've got your vertebral body here, which is where your disc sits. This is the largest part of the spine. You've got the foramen here, which is where your spinal cord runs through. It's nice and protected. You've got the spinous process, which is this bit at the back. That's often, sometimes you can feel that on your back. It's the kind of the pointy out bit. You've got the transverse process here, which are the side bits, and you've got your facet joints here. Now, the facet joints are excellent because they allow the vertebral body to slot together like this, and they interlink there. So as you can see, it prevents too much movement to the side and too much movement up and down, which is why your back is such a strong structure point of the body. So the reason I chose to talk about lower back pain today is it's a really common and prevalent condition. It's thought that it's the 5th most common reason people will go and see a physician, and that 60 to 80% of the population will experience it at some point in their lives. Unfortunately, there is no kind of like one size fits all answer to it, so it's really important to go and see a medical professional and they can make your treatment specific to you. One thing to be aware for with lower back pain is a condition called corner-acquired syndrome. Without wanting to scare and fearmonger, it's a very dangerous condition, and we're always really careful with it with medical professionals, which is why it's so important to go and get it checked out yourself. It can also have other things alongside lower back pain. So if you're having numbness or loss of sensation, loss of power in the legs, so you're really struggling to pick your feet up, or you're experiencing urinary or fecal incontinence. Now this could be going without realizing you needed to go, or going without any warning, or loss of urge, or loss of sensation. And it can also come in the form of loss of sensation within the sexual sense, so feeling of penetration or inability to get and maintain an erection. If you've got any of these signs alongside your lower back pain, it's really important that you immediately get yourself to A&E and immediately get yourself checked out, because the sooner you catch corner, the better the outcome, and it can be a really, really dangerous thing. So the first myth I'd like to talk about is the concept of my back hurts, so I shouldn't move it. This is obviously a really understandable reaction. If something hurts, you tend to avoid doing that thing. And definitely after an initial injury and an initial flare-up, avoiding things that aggravate your back pain are really, really important. However, our spines as part of our body love movement. It's what they're designed for, it's what they love to do. So avoiding movement for a prolonged period can actually really make your back pain worse. Therefore, with back pain, we really advise that as soon as you are able to, without it being excruciatingly painful, is trying to get moving again and trying to keep things moving. Things like walking, things like regular movement, getting back to exercise as you can is actually really, really good for the spine. And we don't want to avoid that for too long a period because it's going to make things worse. The second one is the idea that I'm in pain now, I'm going to be in pain forever. Back pain has got a really good recovery rate, and obviously I can't promise anyone that the pain is not going to go away because, as we said before, it's really individualistic and there could be other things that are affecting that. However, for the majority of people, you can make a fantastic recovery from back pain, and with some strategies and some education, you can come up with methods to, if it flares up again, you've got good strategies to reduce that pain and get back to what you were previously at. So, myth 3. My back hurts, so I must have really badly damaged it. I think this is a really important one to talk about because it's quite a hard concept to discuss, if that actually pain doesn't always mean damage. And that's really difficult because obviously if you're in pain, you're like, I must have hurt something, I must have done something bad. But often it's just our body's way of always protecting us and going, something's not quite right here, I'm going to make you aware of it whilst we work out what's going on. And pain is such an individually specific thing. If you had 100 people all with the exact same injury, they would all experience different levels of pain. Because this can mean pain can vary because of, stress is a huge one. If you're more stressed, you tend to experience high levels of pain. Pain threshold, some people just have better tolerance than others. Experience, have you experienced that back pain before? If you've hurt your back before and you hurt it again, you'll probably have a bit of a higher pain experience because your body's going, we remember this last time and we didn't like this. Things like lifestyle factors, fitness, all those sorts of things can really affect your pain, your mood, your fear, your perceptions of pain, your perceptions of back pain. And it's such a complex picture of things to make this pain response that actually has very little to do with the actual damage that's caused. And I think it's really important to understand that concept because a lot of the time, especially with physiotherapy, we ask you to do things that we don't want to say cause you pain, but might cause you a little bit of discomfort. And if it does cause you that bit of discomfort, that doesn't mean we're doing more damage. That doesn't mean we're making things worse. That's the opposite of what we want. If you do something and the next day you're in 10 times as much pain and you can't move, something's not quite right and we need to adjust what we're doing. But if it's a little bit sore when you're doing it and a little bit more painful, that's not to be a massive concern. That's kind of what we would expect. So we're about to move on to the final section, which is going to be a couple of videos of the exercises, and I'm going to describe those exercises a little bit, show a little bit of sometimes kind of common errors people have with them and how they should look. With these exercises, as I've said quite a few times, I just want to reiterate, there isn't a do this, it'll cure it. Unfortunately, and I really wish there was, it's very much a case of trialing and error of a few things and seeing what works for you, seeing what helps you with your back pain. Prescription wise and looking at how often you should do them, we tend to say quite a lot of the time it's little and often with the kind of more relieving back pain exercises. Especially the one I'm going to show you sitting. If you're in a kind of a desk job and you're sitting for long periods of time, doing that every hour if you can is one of the best things for it. Obviously it's really dependent on where you work, but if possible, trying to get up and just stretch, just move as much as possible is one of the best things for lower back pain. But hopefully with the exercises I'm going to show you, it's going to be ones that you can do in sitting at your work, at home. I'm going to do them in my bedroom environment so I can show you how transferable they are to different settings and what will work for you. The more strengthening exercises, and I've got a couple towards the end, these are things we'd probably look at doing more kind of sets and reps of. So maybe starting with 3 sets of 10 repetitions. So that would be, you do the exercise 10 times, you have a bit of a recovery, about a minute or so, and then you repeat that 3 times. And then as we want to build this up, we build up the number of repetitions. So if you've done 3 sets of 10, and for the last couple of days you're like, this is easy, this is fine, I've got no issues whatsoever, build that up to 15. Try and do 3 sets of 15 and see how that is. If 15 is too much, maybe do 1 set of 15, 2 sets of 10 and see how that is. Or bring it down and do 3 sets of 12. It's quite a lot of it is in your hands and in your way of kind of progressively overloading and progressively building those things up. With the strengthening one, the main one I'm going to show you, I'm going to talk through a couple of variations that you can do, and as you can build it up and further down the line make it more challenging, and how you can progressively overload it that way. But hopefully you'll be able to take away some of these exercises, implement them in your life, and they'll be really beneficial.
So our first exercise is called the cat camel. Now, this exercise is on all fours, as you can see here, and basically what we're doing is curving the spine down towards the floor and then pushing it up towards the ceiling. So we're trying to focus on the lower back movement, and especially on this lower part here, really curving that down towards the floor. And then as we push up, the mid back will come up as well, but the movement is more at the lower back than anywhere else. It's a nice slow and controlled movement. You want to have a couple of second pause at the bottom and then a couple of second pause at the top as well. As we're about to see, you don't really want to do it really quickly like this. That's going to be quite painful on the back, and it's quite an unnatural movement, as you can see. So it's nice, slow and controlled, a couple of seconds at the top, a couple of seconds at the bottom. As well as focusing on the lower back, we want to keep those shoulders nice and set. As you can see here, when we're not keeping them nice and set, the movement is quite alien and it doesn't really work. So it's keeping those shoulders locked in, curling down and curling back up. Next we have pelvic tilts. So this is a nice one you can do in sitting. I've got my hands on my hips here, but you don't have to do this. What we want to do is bring your chest nice and high up towards the ceiling, and then almost slumping and curling forwards. And then again, up towards the ceiling and then curling down. The great thing about this one is because you can do it in sitting, you can do it in any environment. So if say you've got a desk job and you're sitting all day and you can't really get up and get on all fours to do exercises, you can just do it at your desk. It's very similar to the cat camel, it's just in that seated position. As with the cat camel, we don't want to be doing this really quickly again. As you can see here, it's a really unnatural movement and it's going to be really painful. So it's that nice, slow and controlled, bring your chest nice and high up towards the ceiling and then curl down. And just doing this little and often throughout the day will be really good for your lower back. Knee hugs and knee rolls. This exercise is one that you can do lying down. So I'm doing it on my bed here, or you can do it flat on the floor. What you do, bend your leg up as is shown, then reach with your hands and just pull this up towards your chest and then hold. You want to be holding it for 30 seconds to a minute, and it's just a really nice relieving stretch for your lower back. Starting with the right, you can do it right and left. There's no specific way you have to do it. Like I said, just holding it nice up towards the chest and in that nice relieving position. Then bringing the other leg up, bending that knee, pulling it and then holding with your hands and just slightly pulling towards your chest. You don't want your legs to be coming really out to the side like is shown here. If it comes out a little bit, that's fine. Some people naturally move that, but you don't want it to be all the way to the side pulling you over. That's going to be out of position. So having that knee bent, lifting it up, taking hold of your hands and then just pulling to your chest, and not really pulling really high. It's a nice gentle holding it in place and just letting it relax off. You can do it with both legs, so bringing both up and then just hugging your knees and bringing those up to your chest. And you can do one leg first and then both legs, or if you just find both legs is better or one leg is better, then just do that. Then the knee rolls is in the same position. So lying on your bed with the knees bent, just rolling them to one side, bring them back to the middle and then rolling to the other side. Again, as with all the exercises, nice and slow and controlled. Don't want to be doing anything too complicated or too quickly. Just rolling to one side, rolling to the other, and just that nice, slow, gentle movement will get some motion in the lower back. So our final exercise is bridging. Now bridging is looking more from a strengthening aspect than our previous ones that have been looking more stretching and relieving. So all bridging is lying on the floor, your legs bent up like they were for the previous exercises and just pushing your hips towards the ceiling. Now at the top we want to have a nice 2-3 second pause there and really engage in the glutes, hamstrings and that lower back. To make it more challenging, you can bring your hands across your chest, or to make it easier to start with, bring your hands by your side and give a bit more support. Now you're driving up from the hips. As you can see here, we don't want to be doing this again nice and quickly. As with all the exercises, what we want is slow and controlled movements. So pushing up, holding for a few seconds and then lowering down. You can make things more challenging, as is shown here, by pushing up and then coming down. But when you push up, extending one leg. So extending that leg straight, trying to keep your position, and then letting the bum come down. And again, you can do that with the other leg, bringing it in and then coming down. The aim is to try and keep your hips in the same position and not let them massively drop to one side. You're going to drop a little bit because of that change of position, but you don't want to be really tilted to one side. To make it even more challenging again, starting with that leg straight and pushing up so you're working one leg more than the other. Now, this is as you develop and as you start to find things easier, these are a couple of ways you can advance things and just a couple of ideas how you can press things. Other way to progress things could be increasing the number of repetitions. So say if the first time you're doing it, you do 8 repetitions, then you start to find that really easy. You can go for 10 repetitions, 12 repetitions, 15, and progress that way. And the same with sets. You can move from 3 sets to 4 sets to 5 sets. If you really want to, you can start to look to add weight, as obviously this is the best way to improve strengthening. So just holding that on the hips, but it's the exact same movement. That nice 2-second pause at the top, nice and slow and controlled, but just with weight added. So all that remains to be said is thank you for listening to my serotonin session.